What's up, guys? Welcome back to Pen and Needle. This channel we go over mainly topics relating to MD versus DO or anything that we're interested in. Today we're going to be talking about how to get the best healthcare for whatever you're feeling, like symptom-wise, you know? Just go over general things including how to use the resources that are available to you online and what to do if you're feeling something and you want to get it checked up, right? Yeah. So what do you think? What's the best way?
I think let's take a scenario, right?
Yeah.
Let's say I'm 40-year-old male experiencing acute back pain, right?
Okay.
So I'm versed with using the internet. So I go online, I Google back pain, lower back pain,
Yeah.
right? I get all these websites pop up. WebMD is among them. So I go on WebMD and I look at, I read up on back pain. It could be due to this, it could be due to that. In some cases, it could be cancer. In some cases, it could be just musculoskeletal. It could be fracture of your spine. It could be impingement of your nerves. It could be all sorts of different things.
Yeah.
So what do I do?
That's what I'm saying. What do you do?
Yeah.
So what I would recommend is when you're going online to look up these things, right? WebMD is a great resource, right? Because it gives you a lot of information to know about what's going on with your healthcare. However, you should know that doctors have been training for a very long time to diagnose something.
Mm-hmm.
So we kind of know the details of symptoms more than what WebMD is going to go over, because WebMD is going to go over everything. Right? So it's going to scare you.
It's going to give you all the differentials.
And it's not just WebMD, it's just like a bunch of anything that pops up on Google. When you type in back pain, you're going to get scared because you're going to think, oh my God, yeah, I am having back pain. Right. Oh, and my leg does hurt. Oh, yeah. Oh, I do feel nauseous at times.
Yeah, you start believing what you're reading at that point.
Yeah, and then the natural response in the human mind is, let's just focus on the most severe thing. Because I think that's what's happening to me.
Yeah.
And most times
you're
it's
like,
not
my
the severe
uncle
thing.
had cancer.
Yeah. My uncle or my great-grandfather or my great-great-grandmother, she had this type of cancer, and it says, if it's family inheritance-wise, I'm at a higher risk, so I must have it too. So let me freak out and go and do everything possible and get it checked up. It's a scary thing. I know that when you're experiencing symptoms that you haven't experienced, because normally in our day-to-days, we don't really feel too crazy, right? We feel normal. But then when you start feeling something off,
out of place,
then you can start getting worried.
Yeah.
But my advice would be not to go so in-depth with your research. Definitely do some research prior to coming and consulting with a doctor, but don't just jump to the worst-case scenario, because you need to have some type of expert advice. When your car breaks down, right? What do? You think, oh my God, my engine is blown or something? You
can watch YouTube videos, but there's certain things you can't fix about your car. And there's some things you can't really analyze about your car. For example, you might watch a YouTube video about fixing an engine, but that guy's a mechanic.
Yeah.
Right? And you can't think that you can fix an engine just by watching that
and
YouTube
the engine
video.
might not even be messed up. It might just be simple. Oh, you need new spark plugs. Okay, cool. That's like $10. I'll just pop them in and it's all good.
Yeah, that's the diagnosis part. The mechanic spends his whole life training in how to diagnose what's the problem in the car. Like, you just watched 10 minutes of YouTube video.
Hopefully our YouTube video.
Yeah.
But so the mechanic goes through training, and just kind of like the mechanic, we're also trained. And it's not just that we're trained, we also have different specialties in our profession, right? There's a reason why it's not just one person is a doctor and he does everything. So there's a doctor for specific conditions, there's a doctor that covers other conditions, there's surgeons, that go through surgery if you need it. We have different specialties in our profession, and we even need to consult other specialists if we need to, right? So it just, in comparison wise, it's very similar. You don't freak out over these symptoms, and always consult your doctor when you're experiencing anything, One personal story I can tell you is before medical school, like when I think it was undergrad or something, I noticed there was I still have the spot on my hand. It's like this little spot right here. And I didn't notice it before, right? So I went on Google, and I looked up this like new spot on hand or something. I put in some stupid search
Did it tell you melanoma?
It told me that actinic lentiginous melanoma, which has like a super high mortality rate, and I started freaking out like, oh dude, I'm gonna die. I need to. I started eating kale because someone told me that kale is
Curative.
really effective for that type of cancer. So I was going on a kale diet, and then finally when I saw the dermatologist that I ended up paying $100 for, which I wasted. She's like, oh, it's nothing. It's just a spot. It happens from time to time.
But you had to go see the dermatologist because they resolved your fear, right?
Yeah,
you were scared that you had cancer at one point. Yeah. But the dermatologist, like, who's studied for so long, who's done all this research, who's specialized, told you that it's nothing to worry about.
Yeah, of course.
And if it was something dangerous, he would have, like, taken care of that. He'd be like, oh, you need treatment for this.
Yeah, they know this more specific details. Now that I've done with my medical school and I'm going to residency training, of course I know that this is nothing serious. Yeah. But at that time, you know, I know it's really something that can freak a person out. Yeah. Like you think it's life or death at that matter. Yeah. Even something like a kidney stone. A kidney stone is probably like a scary thing. Right. Because some patients come in and they have blood in their urine.
Because it's severe pain also.
Yeah, it's severe pain, and then you see blood in the urine, and you're like, oh damn, there's blood there. Now there's something seriously wrong. Yeah. But if it's a kidney stone, it's simple. It's a simple treatment.
There's steps you can take to kind of prevent them, like dietary, there's surgery. But the thing is,
hydrate yourself.
You will not know it's a kidney stone unless you go to a proper doctor and he diagnoses you. Until then, you'll be mixed between kidney stone versus like all the other pathologies that present very similarly, right? Yeah. So you really need professional opinion. It's good to have information, but you cannot, take that information and start treating yourself basically from over-the-counter drugs, because most drugs, even the most benign ones, have contraindications, have side effects, and you will not know about that. And you might be treating something that you don't even have from over-the-counter drugs. Yeah. Right? Or from herbal medication. You might go the herbal route. And some of the herbal medications, even though they market it as being so safe, might not be so safe.
Yeah, you don't know what's in these drugs. And always consult your physician if you want to do anything, right? Online, it's going to give you everything. Right. They're going to throw everything at you. Yeah. And our natural response is, let's go for the most scary thing.
Yeah, and now it's easier to contact a doctor because they have doctors online. Yeah, telemedicine. Yeah. You can sign up on a website and meet a doctor on a webcam face-to-face and explain them your symptoms. Right. And if it's something serious, they'll tell you to go to a hospital. If it's nothing serious, they'll be like, okay, nothing to worry about. They'll kind of take away that fear that you're feeling that you have this disease. And from there, you'll have a better mental health. Yeah. It's to prevent the fear and the fear overpowering you.
Yeah. And when you go into the doctor's office, don't just start telling the doctor, I have this now, and I want to be treated for this. Because now in the communication system, it might get miscommunicated to the doctor that, oh, is this in the person's history or something? Yeah. And they might start thinking that, oh, you had this in your history. Yeah. But this is just something that you were just researching and you think you have.
Tell them your symptoms. Yeah. I have been having back pain for the past couple of days. Yeah. It started on this time. I was lifting heavy weights when it happened, and then it came on after that. I've tried using heating pad, but it's provided minimal relief. I've taken Tylenol, it's helped. And the doctor will tell you it's muscle pain. Yeah. It's nothing to really worry about. Yeah. Just use Tylenol for a week or so and it should get better.
Yeah. And bring up your concerns. Like if you think it's something specific that you think it is, tell them that, hey, I looked this up over here. Here's the printout or whatever. And here's my symptoms that I also think correspond to this. And we can kind of go over it with you and explain it to you that, hey, it might not be this, or it probably isn't this because of X, Y, and Z reason, right? Yeah. So let's not try and jump to a diagnosis without seeing the doctor. Yeah. Right?
Yeah. No, 100%. Definitely get professional help. Don't let things online scare you, and don't research too much because you might not have the knowledge required to understand what, the information online is saying. Like, it's easy to get information these days because of the internet. You can Google everything, but to understand that information is another topic. Like to understand, like you need
that topic.
experience. Yeah.
That topic goes
Yeah.
into medical school. There's a reason why we have so much training and why
Yeah.
we don't just end at medical school. We
Yeah.
have 4 years of medical school where we learn all of this. It's hammered into us,
Right.
repeated over and over again. More information is added on year to year from research, and we have to stay up to date on that.
Right.
And then there's further training that we go into in
Yeah.
our residency period. And if you want to subspecialize in more training, you can do that too.
Right.
So we have a plethora of training that
Yeah.
we do just to give you the best treatment possible.
Yeah.
So that's why I would recommend come in and see us. Don't get freaked out.
Yeah.
And yeah.
Yeah. So this was a short video, just informing you guys on how, if you are experiencing any symptoms, how to go about them. If you have any questions, leave them in the comment section below.
Yep.
And don't forget to hit the bell icon
And like and subscribe. Yeah.
Definitely subscribe to our channel. We appreciate all of our subscribers. It helps us a lot and it keeps us motivated to make more videos. And we'll see you on the next one.